Well, a minimum of 67% of the population will have to be vaccinated against COVID-19 to achieve herd immunity. Unveiling government's vaccine rollout strategy, the Health Minister, Dr. Zweli Mkhize, says that vaccinating the population will be done in 3 phases, and healthcare workers will be vaccinated first, followed by the essential workers, people over 60 and those with comorbidities in the second phase. The rollout is expected to begin in April, but government hopes to be able to start sooner. Mkhize says that government will have to raise money to cover the costs of vaccinations for 57% of the population. This is because the COVAX agreement will only cover 10% of the vaccinations. Earlier today on Morning Live, the minister explained why the country went the COVAX route.
Well, the advantage of the COVAX facility was that for countries that are either low income or those that would have a challenge in financing themselves, they would have the safety of volumes where a COVAX facility would buy on behalf of many countries, and therefore they will be able to negotiate better prices at that level. The other issue was that the COVAX facility had 9 vaccines in its pocket, when in fact at that time it was not known which vaccines would be successful. And so it was very risky for a low-income country or middle-income country like us to make a commitment in one vaccine when we don't know what the prospects of that vaccine would be for success. And so COVAX facility was offering a possibility of a very huge chance of success based on the fact that there were 9 vaccines and that they would be in touch with the rest of the different countries to be able to pool resources, and therefore it would not be as expensive originally to actually put finances to procure. In the other vaccines, the cost was, the differential was quite huge between the cost of what we would have paid through the COVAX facility and what the rest of the other countries were likely to pay.
Well, the Progressive Health Forum of South Africa has warned that the fact that government only plans to procure the coronavirus vaccine in about a month's time is both inexcusable and unforgivable, and will have far-reaching repercussions. In a media briefing yesterday, the Health Minister, Dr. Zweli Mkhize, said that the government was still in talks with pharmaceutical companies and no deals had been signed as yet. And now to discuss this further, we're joined via Zoom by the Progressive Health Forum of South Africa convener, Dr. Aslam Dasoo. Doctor, a very good afternoon to you. Thank you for joining us here on SABC News this afternoon.
Welcome. Good afternoon.
I'd like to talk about the statement you've made that this is inexcusable and unforgivable, the fact that we'll only be able to procure the coronavirus vaccines in about a month's time. Are you not satisfied with the reasons that were given by the Health Minister last night as to why that is the case? So please expand on your reaction.
Sure. I mean, it's probably important to say that it's not that we are worried that we'll only get vaccine in a month's time. We have no certainty that that will occur. What we have certainty about, and as the Minister quite rightly explained just before this interview, is that we have access to the COVAX facility, which has, in all likelihood, the timeline of the second quarter to offer us some vaccine. Now, it's important also, I think, to understand that the press conference yesterday, the most important and the most interesting part of the press conference was what the minister said, not the rest of what followed. And he said 3 important things that I think that South Africans must take note of. The first is that he confirmed and affirmed that it is the government's position that vaccination is absolutely essential and the only thing that can get us beyond the pandemic. And that, him saying that is very important because it negates all the noise coming from several officials about it not being a silver bullet and so on. Mm-hmm. The second important thing he said is that they have started bilateral negotiations with manufacturers of leading vaccine candidates. This is important because we're not going to get vaccine out of COVAX to cover us completely. And unfortunately, that the fact that we're starting only now is really of huge concern. With other countries which have started 6-8 months ago, as we knew we could. So to only give us today as day zero to start the negotiations is a real worry. And it certainly blows away, I think, any chance of us reaching herd immunity in the expected period. The third important thing he said is that they will have to partner with the private sector. This is a correct approach because I think the minister is very honest. The state's capacity to carry out such a mammoth program just doesn't exist. And the private sector would need to be roped in as best possible to help it with that. So with these three things, the minister, I think, has now set us on a course. We can lament the fact that we didn't start sooner, but we can't change it. Yeah. And I think it's important that we now look forward to how soon we can conclude these bilateral negotiations and obtain some vaccine. Yeah. But I must caution that. Sorry, go ahead.
No, while you're talking about the fact that these bilateral negotiations have begun and the fact that other countries have already started to vaccinate, there was a very interesting point that was raised on social media, and I really would like for you to weigh in on it. And I wonder if you perhaps agree with what was said here in terms of the fact that we're part of this thing called BRICS, and all the countries that are part of BRICS have started to vaccinate or in the process. And they were saying that what's the point then of South Africa being part of this whatever economic bloc, but we seem to be struggling to start as the others have already. Surely it must count for something that we can partner up and negotiate with other countries. Isn't that the point of why we are a part of BRICS? I wonder what your view is on that, because you are quite worried about the fact that other countries have already started to vaccinate their citizens.
Look, I think you put it quite well, actually. What's the point of being part of a organization like BRICS if we can't leverage off it? Well, I think the problem is that our membership of BRICS has suffered the same fate as our relations with other countries which have companies that produce vaccines. So I don't think we can single out the BRICS cohort separate from that. We know Russia has a vaccine. We know China has a vaccine. We know India is producing the vaccines for all of the other manufacturers. So we are in a position to actually leverage off that. I don't think we've done justice to that. I don't think we are likely to, unless, of course, some negotiations are happening behind the scenes that we're not aware of. Yeah. But I have to say that, and it's a real caution to people whose expectations are, okay, whatever has happened, and we will now reach herd immunity by the end of the year. To vaccinate 67% of the population, or about 40 million people, one would need to start very soon, first of all, and it's likely that we won't get vaccine until April at the earliest. And from then onwards, we would have to vaccinate over 150,000 people a day, every single day, for the next 275 days until the end of the year. Ensure we have sufficient supply of vaccine, sufficient supply of qualified personnel, sufficient supply of suitable sites, and an ongoing, relentless 24/7 program of vaccination. Of course, you also need a very willing and cooperative population. Yeah. So I'll leave it to your imagination if we are likely to do that with the team currently in place. That has not served the minister well, and I must say so quite plainly. But it's up to the government, it's the minister and the president who will have to take the bull by the horns here and deal with this matter. We are standing at the back of the queue with all the companies we are starting bilateral negotiations with. They're not going to simply take other countries out of the queue so that we can slip in. We're going to need to do something extraordinary and special to get vaccines before April. And this should worry everyone, especially health workers and the health system which will sustain a couple more waves like the ones we are seeing now.
Dr. Dasoo, you talk about the country itself, South Africa, kind of standing at the back of the queue, but we'll also have a situation where when the vaccine does arrive in South Africa, many of us will be standing at the back of the queue. I'd like to get your reaction on the three phases, the phase approach of who will get the vaccine first. It does, of course, make sense that healthcare workers, for example, will get it. People that are vulnerable, people with comorbidities will obviously be first in line. But there were some concerns that were raised, and one of them being, and this is just one of the examples, and maybe you can expand on this phased approach further, but there was another example raised about the fact that, prisoners will get the vaccine before someone like before an ordinary citizen, and people were really quite upset about that. There was some of the reaction that I kind of looked into yesterday. That is obviously, as I say, just one of the examples. So I'd like you to talk to us, please, about your opinion on this phased approach. No doubt we understand that people that are incarcerated are not able to socially distance as they should, as they are in confined spaces. They can't sit somewhere else. They have to be where they're placed. And already, as we know, the prisons are already very full. But yeah, those were some of the issues that were raised. And I'd really like to get your opinion on this three-phase approach that was spoken about yesterday by the Minister.
Look, I think that's par for the course, the three phases. I think most countries will probably follow a similar route for logical reasons. First of all, the health system is under severe stress, and health workers are getting increasingly infected, sick, and dying. And the problem with that is that, well, of course, the problem is personal, but also at a systemic level, is that you can't replace these health workers. And then the system has to adjust to less personnel. And it eventually reaches a point where it breaks. So there is a rational reason to inoculate the health cohort early and so that they stabilize the system for you and I and everyone else to resort to when we need it. So that said, the issue around prisons, you've touched on part of it. It's very difficult in populations, confined populations like prisons, to maintain the necessary non-pharmaceutical intervention. So the sooner you get them vaccinated, the less chance there is of breeding virus and of creating spread. Because in prisons, not everyone stays in the prison every day. The staff come in and leave. So if there's infection, they are likely to be able to spread it. So it's, again, a rational scientific approach to inoculate prisons and other areas where people kind of are confined for long periods of time. Take old age homes, where we know in other countries there has been a terrible toll taken on people living there because they didn't take adequate precautions. So you would want to get to the places where there's likelihood of spread that's rapid, that will continue seeding the virus within society. So there's nothing wrong with that, in my view. And look, the tiered approach is probably all we can do. It would be great if we could say one day every South African, as we go and say how we do it in the election, you go and you take your vaccination. There's just no possibility of doing that.
Yeah.
So we do need a stepwise approach and a tiered approach. And what you heard yesterday were just the outlines, the broad parameters. There's no operational plans under there, and there's no starting dates, which is the real worry.
Yeah.
And we are not convinced that we will get a comprehensive plan to meet the exact moment we have vaccine in the country. Yeah. So we have to keep an eye on that.
Doctor, just as we wrap up our conversation, there is another thing that is quite concerning when it comes to the issue of vaccines. There seems to be distrust, or maybe I should use the word skepticism about vaccinations, whether the reasons are, and I'm talking from the general public, Doctor, whether those reasons are rational or irrational or linked to religion, but the fact remains that there are some people who are saying, what is this all about Is this vaccine going to change our, I mean, I've heard someone saying, is it going to change our genetics? What, why is there this push for us to have this vaccine? Why was it so rushed? What is going on? There are a lot of questions. And part of my concern is that people aren't readily going to give out their arms for this vaccination, as there is this distrust about the vaccine. And I mean, from your point of view as a doctor, it seems quite simple. Get the vaccine and you'll be fine. But unfortunately, there is this distrust and worry about these vaccinations and what's in them and why we have to get them. So it's not as though everybody's going to go en masse to kind of get the vaccine. And I wonder what you think about that, Doctor. I'm
really not surprised. I don't think there's any bug that has been examined like the SARS-CoV-2, this bug that causes COVID-19. The unbelievable amount of scrutiny on it and the decision by particularly the bigger economies where lockdowns have damaged their economic prospects, and by that also the global prospects, so immensely that they focus their minds. This is not some outbreak in some third world country which they'll hear about as the third item on the news. This is happening right in their cities. So the United States, for example, even under President Trump, decided to start Operation Warp Speed to look at vaccine development, research and development and manufacture without the usual lengthy administratively driven processes that attend such developments, which take years. And because of the urgency of the situation, they eliminated the non-essential parts of this R&D and focused on the safety, efficacy, and so on of the vaccine. So there's no problem with the vaccines that have been developed. They've been properly tested. We know we've tested them here as well. Yeah. And the success rates are quite phenomenal among all of them. And so we know that. There is the issue about vaccine hesitancy. It's important to understand that vaccination is voluntary. Our constitutional order makes bodily integrity a constitutional principle. So everyone has the right to refuse to take a vaccine. And the anti-vaxxer movement, which is by and large quite irrational, seems to have climbed on board here and has spurred a lot of uncertainty through a lot of fake news, unfortunately. But the hesitancy is also about the failure to communicate with ordinary people about why this is happening, saying the things that I've just said, but in an idiom that people are accustomed to understand why they're moving so fast on the vaccines and why these vaccines are still safe to take. We've all been vaccinated as children. Our children are vaccinated. We don't really have too much of a problem with that. And this is no different. So vaccine hesitancy in this country is significant. We know only 53% of people polled last week said they would willingly take the shot. But we are certain that in the remaining sample, a large number of people are just simply uncertain. They're uncertain and quite fearful. So it will have a double benefit if we were to get sufficient vaccine to start vaccinating our healthcare workers, because people trust their doctors, they trust their nurses, and if they witness them willingly taking the vaccine, a lot of that uncertainty will dissipate. There will be a portion, which I believe is quite small, of the population that will absolutely still refuse. It wouldn't matter, because so long as we get to the figure of about 60 to 70%, we have what is known as herd immunity, which means those who are not vaccinated, who may be infected, won't be in a position to transmit sufficient amount of the virus to continue creating outbreaks. It will slowly die off. And that's what we mean really by herd immunity.
All right, Doctor, it's been a pleasure and very informative indeed speaking to you, and well put for our viewers to fully understand and grasp indeed. Doctor, a great pleasure speaking to you and having you here on SABC News this afternoon.
You're welcome. Thank you.
All right, that's Dr. Aslam Dasoo from the Progressive Health Forum of South Africa. He's the convener there. And of course, they released a statement that they are concerned about the vaccine only arriving in about a month's time, as was said by Dr. Zweli Mkhize last night with his panel of experts who are indeed working to bring the vaccine to South Africa. No doubt we'll stay on this story and keep you updated throughout. Well, the South African